Welcome everyone to the V3 implementation call. Today is September 14th. We appreciate you taking time out of your busy schedules to be with us this morning. We feel like we haven't had a V3 call in quite a while, so it's a little bit longer agenda. We so enjoyed seeing many of you at the annual meeting a few weeks ago. We really appreciate you coming out virtually or in person and having those really great conversations with us. It was an incredibly productive event. Thank you for your support on that. As a reminder, these meetings are recorded. We post them to our website and to our YouTube channel for reference later on, or if you want to share a section with a team member that wasn't able to make it to the meeting, please feel free to share that with them. Also, feel free to use your chat or to unmute your microphone. If there's a question or comment that you want to ask or add during one of the topics, please feel free to do so. We'll also have open forum at the end of the meeting. So if there's something that you want to talk about that we just didn't get to or that we didn't go into detail enough, you are welcome to use that time to ask questions or to engage any of the really smart people we have on the calls. This is such a great gathering of lots of knowledge and experience that we have some really great conversations in these V3 calls. Without further ado, I'm going to go ahead and turn over some time to Laurel Baeder. She's going to give us a maintenance update. Laurel.
Thanks, Julianne. Hey everyone, good morning. So I got a really easy maintenance update for us this month. We won't be doing any maintenance. So you should not expect any service disruptions during the maintenance window. And that's all I have for you today. Thanks.
All right, that was quick. Thanks, Laurel. I've got the next item, and this will also be a quick one. We've had a few requests come in for examples of how data has been used to improve EMS, whether that's policies, protocols, procedures, different ways that you run your agencies, or improvements to standard operating procedures. We've been asked in different settings to be able to demonstrate how the data being collected actually makes a difference to the field clinician. We've also been asked to provide some suggestions for maybe some interviews for some best practices for either state data managers or state data managers and their vendors on describing something that they've been able to do with their data to improve the EMS system in their state or in their area. So if you've got specific examples, or you know of someone and you want to sell them out because you know they've done an awesome job with utilizing their data to improve EMS, please reach out to anyone at the TAC. Let us know. We're just looking to be able to share those stories and also to get the messaging out that the time spent that clinicians are investing in data collection is valuable on a local level, regional, state, and a national level. So anyone who's got suggestions for that, reach out to any member of the TAC, and we're happy to gather those examples and share them. Next on the list, we've got a little bit of an update with Jen Correa on vendor compliance testing. Jen, I will stop sharing and let you take over the screen.
All right. Good morning. One of the things that we wanted to, there we go. Now, hopefully everyone can see my screen. One of the things we wanted to kind of remind everyone is that vendor compliance is needs to be monitored and taken a look at, just to make sure that you're staying up to date and you're keeping track of the recertification dates. We are going to resume sending out quarterly email reminders, and we're going to include the next 6 months. We'll separate it by 3-4 and 3-5. And so in case anyone does not know where it is located, on the homepage of NEMSIS, you go up to technical resources, compliance software testing status, and then this will give you the option to choose 3-4 or 3-5, depending on which one you're looking for. And you can go down the top portion. This is the receive and process vendors, compliance software for state systems. Right below that is for collect and send for the EMS agencies. And then below that, you will see any software companies that are seeking version 3 compliance for 3.4.0 or 3.5. Anyone listed here is usually only for their initial certification. So if someone's seeking recertification, they don't necessarily get listed down here. So if there are any questions or you have concerns, please reach out to myself and Laurel, and we are more than happy to answer any questions that you have. And I will throw it back to you, Julianne.
All right, sounds good. I will share the screen. Yes, I'll share the screen again. And then next on the agenda, we're going to turn some time over to Monet, and she's going to give us just a brief overview of boot camp and annual meeting. Monet.
Okay. Greetings, everyone. Can you hear me and see me okay?
Yep.
All right, fantastic. So first of all, and it's already been mentioned, but I'd just like to say thank you for everyone who attended the annual meeting, for all the stress of the travel, trying to get transportation. We really appreciate your participation, both in person as well as on the virtual platform. Just a summary, we did have 35 states represented and 39 vendors. National stakeholders, we had 9, and we were able for the first time to support 27 states or territories. Actually, they were all states, but we supported them financially to participate in the annual meeting in some capacity. Hopefully, we'll be able to continue this type of resource for states. And then for the first time, we presented 5 NEMI awards. And so that was a big hit, and we look forward to doing that again. I do want to mention that we appreciate your very honest comments in the evaluations. We have reviewed those evaluations and will implement them in future NEMSIS meetings. So thank you for that. And last thing I'll mention is that we wanted to have the PowerPoint presentations and the video presentations available on the website. We have a slight delay based on a family emergency with our recording team, but it is anticipated that we will have those videos available within the next 1 to 2 weeks. And again, I apologize for the delay, but we will get those available as soon as possible and inform you when they are available on the website. If you have any questions, please let me know. Feel free to reach out, send an email to the TAC, and we'll be happy to answer any questions. Are there any questions at this time? Okay, thank you so much. We appreciate you for supporting the NEMSIS TAC and the standard. Thank you.
Thank you, Monet. And we'll send out a notice through Google Group when those resources are available on the website. We'll get those to you as soon as we're able. It was really a fun boot camp and annual meeting. We had terrific participation, lots of good conversation, and overwhelmingly, people wanted more time. So that was a consistent theme in the evaluations was we need more time in discussion, more time for different topics. So we heard you loud and clear, and we will look at adding some additional time to next year's boot camp and annual meeting. Next on the agenda, we've got Josh Legler is going to talk to us for a few minutes about an update to Path to Production. And we've got Josh on location at a Connect-a-thon. So I'm going to stop sharing so that you guys can see Josh and see what he's going to share with you. And then when he's ready, I'll throw a few slides up there for him.
Great, thanks, Julianne. Just sound check. Can you hear me okay?
Yes, sound
Okay.
great, video's great, thanks.
Okay, good morning, everyone. I'm at a Marriott in Atlanta right now at the IHE Connect-a-thon, and have been asked to give you an update on the NEMSIS IHE project for interoperability between EMS and the rest of healthcare. And so I wanted to just start out with giving you a little bit of video of what things look like here at the IHE Connect-a-thon, and then I'll switch into a broader project update and things that we're working on. So the Connect-a-thon has two main things going on. Really the most important, the biggest thing is a floor where software developers from various companies are actually hacking away at their code and connecting with each other. And then there's a separate room where some of us have spent most of our time sharing and listening to presentations and connecting with each other and kind of building some of those relationships. I want to show you the Connect-a-thon floor. So let me get situated here so you can just kind of see what it looks like. Okay, so this is the floor for the IHE Connect-a-thon, and they've got about 100 people participating here, just software developers from various companies working on connecting with each other. I know over to my left, there's a whole team from Epic, probably a dozen people. And then like far off in the distance, at the far end of the room, are medical device manufacturers. So they'll have their actual devices sitting on the table there, and they're trying to connect with different systems. So the idea here is that they pick a particular profile that they're trying to implement to send data or share data between two actors. And one of those vendors is one actor and the other vendor is the other actor. It's all described in a profile that IHE has written. And so those two vendors get together with each other and they start working on actually making that connection with each other to implement that particular profile and verify that they can both get it to work with each other. So there's a little view of what's happening there on the floor. So Julianne, if you want to bring up those slides, that'd be great. Okay, great, thank you. So a bit of an update here on where we are with the project to move forward with interoperability between EMS and hospitals and HIEs and so forth. We had a ton of activity going on in August. We had the launch of the project, which we did at the NEMSIS annual meeting. We had an IHE digital series event, August 30th and 31st. That event, I think a lot of the presentations actually were from us. So it was us kind of telling everyone else who attended that event about EMS and giving them just a little bit of a primer on EMS, what EMS does, what we're trying to do with interoperability. We will have future digital series events coming up approximately every 2 months. And what I want to see in those future ones is more education aimed at all of you and me to help all of us understand the rest of healthcare and their data systems and how we need to interact to have interoperability with them. So in a moment, I'm going to show you a slide with some educational topics that I think we might want to ask them to work up for us to help us out. We also need to get some working meetings going. So I'm going to have a slide on that as well, on just our thoughts about how we might get started with that. I would love some feedback. We have the IHE Connect-a-thons, the first one happening now, another one in February, and then looking forward to the HIMSS conference in April. And we would love to have at least one, if not more, EMS software vendors demonstrate interoperability with a partner vendor at the HIMSS conference interoperability showcase. So that's something we're looking forward to. Let's see. Wanted to mention here at the Connect-a-thon, Clay and I did a presentation yesterday about the EMS interoperability challenge. And the presentation was so well received and engendered a lot of discussion. I think that we bring from EMS a really compelling story about how EMS needs to be connected to the rest of healthcare. And so it's really easy for people to understand that story and understand why there should be communication going back and forth between EMS, hospital, HIEs, and so forth. So that's just been great to see. Lots of excitement about the project that we're working on here. We've also held some Friday developer calls the last 3 weeks with Epic, and have gotten a couple of EMS software vendors whitelisted in an Epic sandbox that was set up for this Connect-a-thon. So even though those vendors are not necessarily here at the Connect-a-thon today, they've been able to start sending queries to that Epic sandbox, the same one that's being used here at the Connect-a-thon. I talked with Andrea Forquette this morning, and she said there's still an opportunity. Vendors, if you would like to get whitelisted with that Epic sandbox and do a little bit of testing here the rest of this week. So that's short notice, but if you'd like to do that, get in touch with Andrea or myself and I'll get you over to her. She'll connect you with Aaron Beal at Epic, who can set that up for you. And we've got some sample queries that you could try to run against the Epic sandbox. Okay, great. So Julianne, next slide. I'm thinking that we need to ask IHE to develop some presentations, some educational material for us on the EMS community side. And I've just listed here a bunch of stuff that I think might be potential topics. What I'd love for you all to do is just use the chat and type into the chat the ones that you think would be most helpful to you to get more education about. And if you want to say everything, that's okay too. So I think we just need some general education about HL7, how their standards and implementation guides work. We could use education on the different generations of HL7, B2, B3, and FHIR. IHE and how IHE profiles work. The concept of provenance, how we prove where a document came from and who has had custody of it. Patient identification and matching, how to do that. Laws about data sharing. Then the Office of the National Coordinator for Health IT has a certification program. Maybe we need to learn about those. There's the TEFCA, how EHR systems work, how HIEs work. There's a couple of specific networks out there, Commonwealth and Care Quality. So those are the ones I've thought of. And if you've got others, throw them in the chat. And again, if there's specific ones on this list that you think are more important to learn about, please do that. I have the sense that we could really benefit from just getting more education about these things so that we can come to the table more well-informed. Great, I really appreciate all the chat comments coming in. Okay, so hopefully I stalled and talked long enough so you could look at that list. Let's go ahead and go to the next one, Julianne. Okay, the working meetings, we need to get these going. We're just trying to work out how to do it. As we've gotten into the project, we see so many things that we need to work on. And so that's great, but the challenge is like, how do we prioritize all that? And how do we work on things in a targeted way so we actually make progress? I feel like if we work on everything all at once, we might just kind of spin our wheels. So I've listed there, various issues and topics that we probably need to work on. So this is not talking about education. This is talking about like, we actually need to build something, right? We need to build a document, or we need to build some resources, a publication of some kind, some deliverables around these topics. So the thought is maybe we try to prioritize these and pick the top priority one and schedule one or more working meetings to work through that topic and kind of put the other ones on the table for a little bit, get something actually achieved with that first one, then go to the second one and so on. So that's the best we've thought of so far. We would love your ideas about how we can really move this forward. Again, the end goal being that we've got interoperability between EMS and other healthcare data systems as just a routine thing. So how do we get there? So again, I would love any comments you might have in the chat. Also, feel free to unmute yourself and to discuss verbally. If you have any ideas on how we can make these working meetings effective, targeted, where we actually get some progress made. So any thoughts on that, either by chat or if you want to unmute? Okay, well.
Hey, Josh.
Yes, Clay, go ahead.
Yes, sorry. Maybe I'll throw out a question just to see if it stimulates some other ideas. Perhaps one of the questions we could ask this group, particularly among the vendors, and we'd love to have some state participation as well. How often should we be holding these working meetings? What is your kind of limit, right, for how often we could meet and make sure that you would have the time to understand the topics, prepare for the meetings, and actually, I feel like you're participating and learning, but it's not overly burdensome. We've talked about having meetings as frequently as a couple times a month or once a month. What do folks feel? Any thoughts about moving forward with this? I imagine this is a high priority for many.
I think also, yeah, go ahead.
Go ahead, Andrea.
Oh, I was just going to say, I think it's important to kind of like these meetings to be for everyone on the calls who are interested in learning, but I believe we're trying to feel how often we want to run these meetings, because we might want to be doing some more technical developer level meetings versus high level education meetings as well. And we want to know like the frequency of which would be most useful for everyone, just to make sure that they're either not long periods of time in between or not too short, so it becomes too much of a burden to be attending.
Yeah, thanks for the comments coming in through the chat. That's great, especially for me today. I'm not writing down notes, so I'll be able to review all those.
There was also a little bit of discussion in the chat about cost playing a big factor with this. Any discussion on who bears that cost and any ways that that can be supported?
Yeah, I think it's an important topic we're going to need to cover. Amit Trivedi was just telling me yesterday that ONC is looking at doing a pilot project. And so there will probably be some money coming through that opportunity. So that's good to hear. But yeah, like ongoing, we want sustainable solutions.
Yeah, Josh, and I'm also still trying to wrap my head around the great work that IHE is doing. The participation and pathway to production for vendors and for states who may want to track with that. We've covered that cost. And so the NEMSIS TAC has covered your participation and path to production. So your ability to participate in many of the things that Josh listed on that calendar is already covered. Now, the cost of attending a Connectathon or the HIMSS conference, I think that is separate right now, but the NEMSIS TAC maybe could offer some help there as well, if that would be helpful. So we're still trying to work through that, but most of the participation that Josh is talking about now on a monthly basis and having experts and other vendors like Cerner and Epic in the room and talking with us about how to connect, all that will be free to participate in.
And in addition to that, the the participation for things like Hinson and the Connectathon. IHE is working to like put forward and allow some of the scholarships that are provided to help cover some of these costs as well. So we are also looking at that cost support on the other end as well.
Yeah, and this is Amber. Just to elaborate a bit on my comment, I appreciate all the insights to some of the opportunities out there. I think just taking a step back, a broader view, at least from a state perspective, is a lot of our vendors already have tools that allow data to flow between multiple different systems. And I can appreciate all the work that is allowing more of that to happen. The issue is, we at the state see the huge benefit for this type of data exchange, and linkage, but we have a really hard time figuring out how to actually implement some of those opportunities, because the question is always who's gonna foot the bill. It falls on our hospitals a lot, but our EMS agencies are really the ones who see the benefit there, but don't necessarily have the funding to cover those types of opportunities. So just in this identifying and prioritizing issues, I think thoughts about how we can approach covering those types of costs from a state perspective would be really useful, or any other perspective, but that's been a huge barrier, right? The technology exists. It's just a matter of getting it in the hands of the people that need it. Just one person's insight.
Thanks, Amber. I
That's
think
great.
that's really important.
Yep.
Yeah,
Thank you.
Amber, let me speak to that for just a second, because it was brought up at FICOMS with the Federal Interagency Committee for EMS on our last call, and will be on your agenda for the next call. And it's also something that's high on our list through our office and working with Rachel at ONC. You're right that historically there's been success in localities, there's been success in states, and I liken this to EMT basics using glucometers. Something that the technology came about, made it pretty simple. A lot of people can do it, but everybody's adopting it in different ways. Some are saying no way, this is not part of the scope. And then when they do, glucometers are cheap, so that's a bad example for this. But when they do, you look at the hospitals who have been asked to fund this, and if you're a small rural hospital, but you service 7 or 8 EMS agencies and they use 6 different EPCR vendors, that cost adds up significantly. So the next piece of this is, does the service pay for it? Well, the service probably doesn't have enough money to, buy the tablets and computers to do the connectivity, let alone pay for the connectivity pieces. So we kind of outlined what this is. A part of the problem, though, with it is we're trying to wrap our hands around what the costs are, and then what costs can be used to develop it one time and pay that vendor one time, as opposed to each individual service and each individual hospital paying for the same real estate. That's been the plan since the beginning with a lot of things in terms of NEMSIS. And then we can figure out what federal agencies have a stake in this. Does the bill infrastructure money, for example, that wants clearly written in it, crash data shared with trauma centers, and they want feedback from the hospitals on the outcomes of those patients, is that a part of this process? So a part of the reason for doing this exercise is there has been great success in quite a few states and quite a few agencies in making it happen, is identifying what model works somewhat nationally, because I don't think there is one solution for the entire country at one point in time, but what model works, what the actual fee structure is, who would need that money and how much is it, and then that dictates where you go to find it. Hopefully that makes a little bit more sense than it sounded.
I'll add on to that. There are relationships that we're trying to investigate and
I think we lost you, Andrea.
We did.
Something else that might be helpful too, as we look at the prioritization, is perhaps specific asks or what specifically we would need from a state, or how a state can be involved, as we've got so many data managers on the call that have varying levels of experience in EMS data or in the interoperability. Maybe that's something that we can provide is a more specific description of what next steps or how a state can support, if you're new to it, if you're moderately familiar, or if you're an expert in it.
Yeah, thanks, Julianne. Any chat comments from state people? We'd love to see that, because this isn't just about supporting software developers. We've got to cover all of our bases here, I think. And so, yeah, that'd be really great to have that input. Okay, I've probably taken enough time. Thanks, everyone. And thanks for all the great input. We'll keep moving forward with this project. Lots to do. Thanks.
Thank you, Josh, and thanks everyone for putting comments in chat. We save those and refer back to them so that we are aware of what your questions are and needs are. Next on the agenda is Clay. We're going to talk a little bit about the NEMSIS versioning discussions that have been going on. Clay, I will turn some time over to you.
All right, thank you. I'm going to go ahead and share my screen, and I apologize. At an IHE connectathon, you wouldn't think that my internet connection would be a little unstable, but it is, because I'm not using the connectathon connection right now. So I'm going to go ahead and share my screen if I can. And I apologize. You'll see that beautiful picture of Julianne for a moment. All right, fantastic. I'm going to change gears a little bit here and reintroduce and just provide some more information in regards to what we've done to socialize the revision cycle for NEMSIS that we discussed at the annual meeting in Deer Valley. So we have made some progress there. We've taken our thoughts that we shared together during Deer Valley, other comments that were shared with us after the meeting ended regarding the revision cycle that we just proposed as a potential option, and have presented that to the NEMSIS internal advisory board and external advisory board. Those two advisory boards deal with the standard specifically. How can we improve the standard, improve its efficiency for our providers? That's the internal group. And then the external group is focused on interoperability, right? So with the revision process, how does that affect other people who utilize our data, such as billers and others? So I'll just do a quick primer to bring people back up to speed as to what we were thinking of. I'll share with you what are the current thoughts. And I think, and Eric can correct me if I'm wrong, but I think this will be the last time that we will be presenting this before Eric is going to do a formal presentation for among the EMS state directors to try to get their buy-in on this as well. So I'll go through just a quick primer. You may remember we talked about several different types of versioning. There's kind of an informational type of a build that could happen that could be conducted as often as every 6 months. It's kind of just correcting typos, updating links. Talked about a minor release, and we talked about this mostly with the idea of what would be included in a minor release or changes that are more permissive to the standard. So examples were given here. We were corrected with great fervor at the annual meeting that we should not include changing an element from a one-to-one to one-to-many in the minor release type of an approach. So one of the clear thoughts that we've had at the meeting, and we talked to our advisory board members, is we need to do a really good job of describing what will be included in a minor release. And so that's in preparation now. Then we talked about a major release that it could happen as often as every 6 years. These are truly the changes that are not backwards compatible, right? So these are adding new required or mandated elements, updating schematron rules from warning to errors, other things like that. And actually, 48% of the 170 current suggested revisions or updates to the NEMSIS standard, 48% fall within this category. So it still is an important category of change. And then we talked about a critical patch. When we tried to bring together the idea of a major and minor revision, we presented this at Deer Valley. Folks will remember seeing this and how this process of just having minor revisions happen to keep us more up to date in regard to the standard, that it still allows the window for example 3.5 to stay open for the traditional 9 to 10 years that we've done in the past. But the updates are made as vendors enter their 2-year compliance testing process. The compliance test cases would include attributes of the minor updates, right? So keeping the software update and allowing states to choose when to quote move between these different versions. So I'll just share that briefly. Some of the ideas that were important that were shared at the annual meeting that we presented to both the external and internal boards was it was important to developers and to states that they understand what's happening before each of these versions are released. So we talked about, in addition to a revision cycle, a process or development cycle, right? And we talked about this idea of having a year out in front of any minor revision and having 18 months out in front of any major revision. So you can see 3.6 would have an 18-month period. One of the things that was important for vendors is that they would understand that during that year, for example, in front of a minor revision, there would be this development going on. We would be reviewing and finalizing the final changes, but that then there would be a cutoff date when a final version would be released out to the vendors and to states, and so they could begin implementing in their products, and states could start the processes of any educational work that needed to happen or other things. Updating schematron rules if something like that needs to be done in relation to some of the changes that were in a minor revision. So we've added those on, and kind of just to give you kind of a look at what those two would look like together, right? The revision cycle is represented in the process cycle, but you can see where we have that information on the front end to make sure that we're developing a solid minor revision or major revision. So the major comments that we've tried to address so far that have come out of the meeting together in Deer Valley and among the advisory groups. Number one, we will make sure that we implement this, that there's some kind of a ranking of each change as to whether it has a low, medium, or high impact on, number one, developers. So actually technical implementation, but then also separately providing an assessment for states, right? For them to understand, wow, well, what's the impact of this on education or on schematron files or on state data set? We'll further refine and give examples of what's a minor revision. You see the timeline, we've added a development and release. And implement by is a little bit fuzzy, right? Because we're kind of setting up these minor changes as that they will just be incorporated into the compliance testing process, and states can implement, vendors can implement, but there's not a drop dead date associated with movement between minor revisions. Love the idea by Jay and others at the Deer Valley meeting that states developing custom elements, if they could stick or make those revisions in kind of the same timing or cadence as minor revisions coming out, that would be incredibly helpful, I think, to developers. And for the Data Managers Council, who will begin working on like updating defined lists and common definitions, if that work could kind of be scheduled in the same way, that would also be incredibly helpful. So we'll flesh that out more. There continues to be this idea that maybe we need to have a quicker version that would come out for national emergencies, like COVID did, and we developed for the first time national custom elements. We'll try to formalize that a little bit more. I think it is going to revolve around that idea of national custom elements, and we'll try to forward some ideas there. And then finally, there was discussion about whether value sets could be versioned, and we're working on that, particularly in association with the trauma triage guidelines that have been updated. Is there a way we'll still have 2 elements in the e-injury section associated with that idea, but could we version the value sets, the old version of trauma triage and then the new version? So we're continuing to work on those thoughts. I wanted to open it up one last time for any comments that you would like to make sure that are discussed within the TAC, and also as Eric takes this to the state directors. And Eric, if you have other comments as well, I'd love to hear your thoughts here as well.
I have no other comments. This will be the sounding board to take this to the state directors and talk about the follow-up to what I've been sort of priming them with, to say we need to have a more agile way of making changes and have that process known so it's clear what that is, and then if possible to put a timeline around it so people have the chance, not just the states, but the vendors and everyone involved, to plan for it and realize what's coming. And then the first part of the ranking, what is going to be changed and how it's going to be changed. That piece, working with the SUMSO liaison and working with the data managers groups and subgroups to figure out what that is. I mean, that's been that's something in my mind that should have been done early on in NEMSIS, but it's here now, and it's formalizing the process so that we can move forward.
Thank you, Eric. Any other comments from the folks on the call? Kind of other thoughts you had after we've had a chance to meet together in Deer Valley, or there's several folks on this call that participate on the advisory boards.
Hey Clay, this is Kelly. I just had a quick question. Do we, and maybe this is more for Eric, I guess, when are you planning on presenting that to the state directors, if you don't mind me asking?
I don't have a date and time. My conversation with GAM is on Friday to set up a date and time. What I'm anticipating is requesting that we just do a state directors meeting on data collection as kind of an update to all the different things that's going on, not just with NEMSIS, but with White House data requests and other data requests that are coming in, and keep them all on the same page. Because as I get reminded quite frequently, the data managers do not speak for the state directors. Not all state directors and data managers speak routinely. I don't understand that, but that's what I'm told, and I have clear evidence of that. So it's, for me, it's going to be sometime in the next month. It's not going to be in October 9th through the 30th, because I'm going to be out of the country. So it's going to be either, I suspect it's going to be right around the first week in November.
Okay, thanks, Eric.
And Kelly, we've actually had, Dr. Kramer and I were out in Utah. It was, as he was just departing, we had a specific meeting like this just on NEMSIS data to update the director. So we've done this in the past. And I think it's something that as I look towards 2023, I think I'm just going to set something up like this quarterly for the state directors. There's that much stuff going on with NEMSIS and data, and like the IHE connectathon stuff, and make sure they understand what's going on. I think the other pieces that we talked about, meeting with the state directors, just like we have done with the vendors. And that's going to start sometime probably right after I get back. So probably right around the first week in November as well.
We are definitely looking forward to that. Thank you for offering the vendor meeting. We appreciate it.
This is Samantha with TSO. Is it possible for us to get like the slides or a write-up of what each release type would be in this timeline? I'd like to socialize this with other people within ESO, and going off my notes, I'm a little hazy on a couple of things.
Yes, Samantha, I think that would be fine. I think, as Eric mentioned, we'll probably take another week or so, or a couple of weeks, to kind of more fully flesh out the idea of a minor revision, what would be included, and providing perhaps a criteria for the ranking that's talked about here in item number 1. So yeah, we'd love to further develop those, and we can certainly make those available so you see what's being socialized by Eric among the directors. Eric, is that okay?
Yeah, full disclosure, we still have one more meeting to finish the 19 pages of notes that were taken from the annual meeting. So I want to make sure we've incorporated all of the comments because not all the comments about this process were in this session. Sometimes what we found is that there were comments made in like Ryan Stark's session that impacted some other presentation. So we're making sure we've incorporated everybody's comments. And then, yeah, absolutely, we make the slides available. There's absolutely no reason not to.
Awesome. And maybe you can clarify one point for me, because I was looking through my notes and I didn't have this. Define list updates, would that just be part of the informational cycle, or is that going to be separate?
Yeah, that's a great comment, Samantha. I think that would be included in informational updates.
Okay. Perfect. That's what I was thinking. Thank you.
Yeah, thank you, Samantha. Right. Any other comments regarding the potential revision cycle for NEMSIS? All right, thank you. If you have other comments, please feel free to put them in the chat, or to contact Eric or myself or Julianne. We would love to add your comments to the consideration as we try to clean this up for the vendors or for the directors to see. All right, Julianne, turn it back over to you.
Just in time for me to send it back to you. The next item on the agenda is discussion about the ONDCP data sharing.
Okay, that's right. That's right. Happy to do that. Thank you.
Okay.
Yeah, thank you. So, yeah, a little bit of switching topics here. So folks who remember, almost a month ago now, we have released a request to states that they approve the use of some NEMSIS national data by the Office of the National Drug Control Policy within the White House. And a letter from Dr. Grupa was associated with this request. We've only had 10 states that have responded to this request, and we're here to take responsibility for some of that. As we have, we put together 2 informational meetings shortly after the letter was released on 2 Thursdays, and we had several states that participated in that. And we learned there that we made the mistake, the NEMSIS TAC made the mistake of trying to socialize the idea of 2 things at one time. The 2 things, and the one that's talked about by Dr. Grupa, the director of the Office of National Drug Control Policy, what he was requesting was the ability for his office to utilize and track opioid overdoses as attended by an EMS professional at the zip code level. So that was ask number 1. But what we did at the same time was socialize and try to talk about the idea that the ONDCP was seeing so much value in our dashboard that they wanted the ability for states to see similar type of data, that when this office worked with regions, jurisdictions, or states about how best to tackle the problem of opioid overdose, that they would see the same data in some format that would allow them to talk and communicate effectively about the same data that they're seeing. The mistake that we made was to try to socialize both requests, I think, at the same time, right? So states were looking at what the ONDCP dashboard was looking like and thinking, well, we may not want that exact dashboard to be released to more public audiences. And so I think what we're trying to do here is to potentially back off of the idea of socializing both of those ideas at once. Clearly, we've received a lot of good information from states about what they would approve as a state release of data. And we're working to build a wireframe to, again, socialize that idea. But what I'd like to ask the state data managers here on this call is, if your state has not had a chance to respond back to us, what could we do to help facilitate your assessment of this specific ask by the Office of Drug Control Policy for their use of the zip code data? And Eric, I'll stop there and just make sure I've characterized that correctly.
Yeah, Clay, I mean, you summarized it very well. I think the perception of what gets released publicly versus what doesn't is what's really driving a lot of questions here. And then there was other concern discussed about how this relates to maybe work that's being done in your state that maybe calculated differently or looked at differently, or those are all valid concerns. This request, and this is as you start to look at how the federal government does business. If you look across ONDCP, if you look at the CDC, if you look at ODMAP and other, I mean, there are a lot of people reporting opioid data and a lot of people reporting it differently. If there are questions about how this data would be used and what it would be, what the messaging is behind it, we can certainly have Megan from the office present to the group. We can make that a part of the state director's data call. I do intend to ask her to speak to them about it, to kind of help validate and alleviate concerns that they have for how this data would be shared and what the intent was. I think that's part of the unknown here. And as Clay said, anything we can do to help facilitate this process in your state, if you need us to have people from ONDCP speak to your lawyers or whatever, we're more than willing to do that. Just let us know what that is.
Have any states shared or have comments that they have been exchanging with the legal departments within their states, or with EMS leadership or public health leadership, and what some of the thoughts are about utilizing national NEMSIS data to help characterize the opioid overdose epidemic in this country?
A couple of comments in chat. Clay, are you able to see those?
Oh, yeah, thank you. Yeah, so Anne brings up a great comment, and this was partially associated with us kind of mixing the public versus what the White House can see, and releasing the data at the zip code level. So again, we we need to kind of work through that idea and maybe characterize that in two different ways for two different audiences, right? What would be released to a public dashboard and what the Office of the White House ought to be able to see. Okay, it looks like Peter is on board to talk to his leadership in the near future.
And the law enforcement versus public health use is a tricky one to answer for us because I don't know what the actual intent's going to be. I can tell you that from the discussions we had, the focus has been on the healthcare side, but I can't say the law enforcement agency isn't going to look at it. That would be a hard one to, that would be a hard one to sell to me at any level, because once you put the information out there, it can be used for, it could be viewed by law enforcement, it could be viewed by health, it could be used by a prevention team. There's so many different ways to look at that. That's kind of tricky.
Hey, Eric, this is Ann. I can't type as fast, or I would have typed it in the chat, but in Arizona, we actually release a zip code level report of opioid overdoses every month. And we do send it to law enforcement agencies, but they have to sign a data use agreement at a station that says they will not distribute it outside their agency and they will not use it for any law enforcement purposes. I know it's just a promise, but that was one of the things even in our state where there's other organizations that want access to the data and it's not something we can grant them. But we will give it to law enforcement. They just have to basically sign something saying they won't use it for that.
Thanks, Dan. And I see where Cassie said, can we suggest a data use agreement? Maybe there is a generic data use agreement that can be put together. That's something we can ask Megan about. That's very important to me, Cassie and Ann, because this is the first request of, I think it's going to be many to come. We expected to have another one by now. There was a medical emergency with leadership on the other team that has set it back a little bit. So we're going to see additional requests come this way. We want to distribute them in this manner to have individual states sign off on them. In the past, this would have been no, we can't do this type of thing, even though the data exists and it's out there. So this is another place where we're trying to put in place processes where NEMSIS data can be used and the system can be used as it was intended and as it was built. So any request that you have, hey, look, if it takes a data use agreement, we'll put something together. I'm just not quite sure who signs off on that, given the parties involved here. But doesn't mean I'm certainly happy to ask and find out.
Yeah, other great comments by Peggy, Ridgely, Felicia, Cassie, Chip, Peter, and Jason. Yeah, thank you for those comments. I think we're seeing a lot of the questions that we expected to see, and we need to formalize, I think, some responses here that we'll see if we can deal with these.
This is absolutely, Clay. This is what we need. If there's specific concerns like data use agreements or like the sharing of law enforcement or a less than 10 versus 5 small cell suppression, let me know what those are, because those are the things that we can go back then and address. But just addressing a no response or someone saying, well, we have concerns, we can't do that. And we have some high level expectations here. To me, this is a way for states to show off all the hard work they do. And then it also gives them the ability to say, hey, look, this is what we need support. We can do these types of things for you, but we need the support to do this kind of stuff. This just doesn't happen overnight. That's my intent. It's been the intent since the beginning. And if there's ever any questions about that, please let me know.
To answer Peter's question in the chat, Peter put in there re-identification between the demographic and the zip code. And the way that the way that the report is built is that they are not, they are independent of each other. You cannot use the demographic data to clarify what's on the mapping. So Clay, I'm sure there's a better way to describe that to answer Peter's question, but they are not interactive with each other.
Right. Within the dashboard as it's currently drafted, that's true. And we can even make some additional changes we've talked about that will make that more apparent. So we'll work on that. And then also Judy's question about who to reach out at the NEMSIS TAC in regards to questions about this letter. It would either be Julianne, myself, or Eric. We'd be happy, I think, to answer any questions that the state of Texas or other states may have. So yeah, please feel free to reach out at any time. If you get questions, just feel free to reach out to us and we'll try to respond back as quickly as we can as we develop more kind of information regarding this request. All right, any other thoughts that folks would like to share? Other comments? Yeah, good idea, Cassie. Maybe this is another topic, Eric, that we need to cover during that scheduled meeting with the directors as well. And we need to bring this back to the DMC as we develop specific narrative and guidance.
We can certainly do that.
All right, Julianne, if there's no more questions, I'll pass it back to you.
All right, thank you, Clay. I'm going to share the screen. I've got the next item on the agenda, and I just want to share with everyone where we have the resource of post-crash care, EMS response to MVC-related injury. As we see funding opportunities, possible funding opportunities pop up and come our way for traffic-related injuries and some of the BIL, other things that are coming through. Safe Streets for All, we sent out a message on the Google group to make sure everybody knew about some of those opportunities. So one of the things that we've been working on for quite some time is a monthly report on categorizing the impact of MVC-related injuries. And I'm going to show you where you can find that on the website. If you go to nemsis.org, sorry, I'll try and not go too fast to make you dizzy. If you go down to this blog section, we've got post-crash care EMS response to MVC injuries. If you click there, it's going to take you to a page that is updated each month with the previous month's report. And for this one is July. August will be up there pretty soon. You've got a link to download it, but it's also presented on the page for you to see. I'm going to go ahead and bring that up so you can see the whole thing. We update it as a PowerPoint and then share it in a PDF. And we're able to share this in other formats if it's more useful to you in another way. Post-crash care, EMS response to MVC-related injuries. It is a large report. So there's a lot of information included here, a lot of talking points, a lot of language that you can use as you're writing grants or applying for partnership or assistance in trying to address the traffic safety in your state. So you'll get talking points in the notes, a lot of detail in the notes. Those will all stay static. There's materials that you can use in local presentations if you would like. I know I'm going fast. I'm trying to get to the parts that we update each month. So you'll be able to see the overall trend of MVC regardless of type of injury. Some MVC patient demographics. How we define severe injury in the data. Then we offer you a trend line over several years for severely injured patients in MVC incidents. Pedestrians, how often are pedestrians injured in an MVC? This is one that we've shared before, also in other settings. The increase of MVC versus pedestrian rates have not returned to a normal line. We've got quite an increase here. This is especially valuable with October being Pedestrian Safety Month. So that might be valuable in some of your outreach materials. Older adults, again, older adults injured in an MVC is still showing an increase. This yellow line, it's a little bit hard to see, but this yellow line coming across is what our 2022 trends are looking like. And I'll just show you one more, and there's more in here. It would take us, we need a good half hour just to go through this report. I just wanted to make sure everybody knew where that resource was available, that you are welcome to download it, use it as you need it, use the language out of it. It's pretty new out there. So if you see edits that we need to make, please let us know. And if you need it in a different format, let us know. If there's one of these trend lines that you need to see that's specific to your state, we've got the code written and can run that for your state. So we're happy to help provide those resources for you as you communicate the impact of MVC related injury.
Julianne,
Yes, go ahead.
Quick couple more things. So as you, if you use these materials and people ask, well, could we look at, ejected from vehicle in another way or by time, something specific by time of day, if you would share with us what those additional asks are, like we did COVID, we can build some of these things in. The intent here is not to take the place of anything that's being done at the state level. You can look at this specific to your state, you look at it specific to a county, your agencies, by all means. And we're happy to help you with that if you need assistance with that. The intent here with this project is to put it in front of, for example, Nanda Srinivasan, who is GAM, we did Tungar, EMS office director. He will be attending Governor's Highway Safety meeting that starts this weekend. Nanda will he will not be presenting this in total to the group, but Nanda will be have this information along with some other things that are very similar to this to say, hey, look, here's how your governor's office can request EMS data, and here's the value in that and what's available. So we're trying to make sure that as we talk about what's out there, there's a consistent message. And this is what our offices of traffic safety are seeing. And that way they know, hey, look, you can look at things by race, you can look at things by sex, you can look at ejection specific. They have, in some cases, I don't think they have a clue that this is available to them now. And they're so embedded in fatality data and looking at death that we're really trying to pull them back and show them, especially with the one like Julianne showed you, the pedestrian injury. There was an article in the New York Times here not too long ago. We're going to put that out with this particular slide and say, hey, look, the New York Times is saying what we're seeing nationally is happening specifically in that large urban area as well. So we're trying to draw as much attention to, hey, look, here are these national entities or this national recognized newspaper and saying exactly what we're showing you with this data. So DOT folks, by all means, you should be focused on, if you're really going to look at prevention and preventing death, you have to prevent the injury from happening first. I still have struggled with the concept of measuring the success of a program by looking at the absolute worst case scenario. So, you can say 10 people died, but if another 100,000 were injured, the real number here to pay attention to is that there were at least, 997,000 people who were injured. Three of them could have died, but the rest of them lived. There's still a big problem there. It's not just about those three who died. So that's the story that we're telling. We're setting up for all the national traffic safety conferences and things next year to keep telling that story. So I'm sure you're going to have a lot more interest in these reports. So if there's anything we can help you develop or add to this to make it easier, we're happy to do that.
All right, I will throw the link up there where you guys can find the updated version each month. Okay. There we go. Next on the agenda, Eric, is there anything else you want to add from the Office of EMS?
I don't think there is today. I guess it's a follow-on from, like Monet said, for those you participate in the annual meeting, thank you. Personally, for me, I will be out of the office, as I said earlier, for a big part of October, and I will be out of the country, out of the office. So Dave Bryson, I believe, will be taking over for me. So you'll probably see him at some of the meetings. I will make sure that you have his contact information, so that if you need something, you're more than welcome to reach out to him. Otherwise, we'll get all these meetings set up that we've just discussed, and Julianne and Clay, as always, the TAC team will be available to address any of your questions or concerns.
Any additional questions for Eric? Any items for open forum, questions, concerns, topics that we didn't get to or didn't go deep enough into? Anything that the participants on this call would like to bring forward?
I was asking about the change log. It's a PDF right now. Is it possible to get that as the Word document?
Yes, David, Laurel is on that today and is going to send that out to you.
Okay, thank you.
Yep.
I see the message in the chat about concerns from e-bikes and the nature of injuries. There is talk about in DOT, e-bikes, skateboards, hoverboard. There's this whole micro mobility grouping. And that's certainly something we can look at as expanding out the selection there. There is some discussion about what constitutes an e-bike. Is that just an electronic bike? Apparently, and I'm not the expert in this area at all. Apparently, there are many variations around those. So yeah, Peter, we can look at the ICD-10 codes for micromobility, and if we need to build out something custom. But I think that's something that DOT would be very interested in seeing, how many of those injuries are occurring and where they're occurring and how severe they are.
Would everybody be interested in that resource? I recently shared it with another state just a week or two ago. And I'm happy to put it to the Google group instead of just one-offs if, okay. And Peggy, all right. It's a done deal then. I'll put those resources to the Google group for the micromobility ICD-10 codes.
And absolutely, because for no other reason, and I think I've shared this with you all before, I apologize if it's duplicative. I'd have lost the bet when we did the presentation that Julianne shared with you that we're putting out to everyone. If you asked me what was more severe, a person being hit by a car, person being hit by a car on a bicycle, or a person being hit by a car in another vehicle or whatever, there are several categories there. Clearly, the person struck by a vehicle on a bicycle fares worse in terms of fatality and severe injury than all the categories. Not in terms of quantity, but in terms of severe injury. So I think there's going to be a lot of interest in bicycles. And every time we present this, we ask bicycle people in the room and they get excited about it because they're like, hey, this is what we've been trying to tell people. But again, the focus has been on fatality. So unless they died, it really didn't count. Now we're showing them, hey, look, severe injury went way up and that's driving them to death. So more to come on bicycles. That's an excellent question and observation.
Anything else for open forum? All right. Our next meeting is in 2 weeks, September 28th, and then we're back to our regularly scheduled program twice a month in October. We will also have an October public training, and we'll send that information out to you in the next couple of weeks so you all can plan for that. Thank you for taking time to be with us this morning. We appreciate your comments and your input. Please reach out to any of the members of the TAC with questions, or if there's anything specific that we can run for you data-wise or report-wise, or anything that you would like to see done differently or suggestions. We're happy to receive those. Thank you all, and hope you all have a terrific and safe day. Thanks, everyone.